Good day, everyone. We are the Group 20. I am Harold Kumia, and with me is my partner Ariel Malit. Today, we'll be discussing the different lie detection techniques and how they are used to determine truthfulness. So, ano nga ba ang lie detection techniques? These are methods used to identify whether a person is telling the truth or not through their behavior, speech, and physical responses. In our daily lives, we already try to detect lies without realizing it. For example, when someone avoids eye contact, keeps changing their story, becomes nervous when asked simple question, we may start to doubt them. However, these signs do not always mean a person is lying. They might just be anxious or uncomfortable. There are several types of lie detection techniques, such as first is behavioral observation. This involves watching a person's body language, facial expressions, and tone of voice. For example, fidgeting or avoiding eye contact may raise suspicion. Number two is interview and interrogation techniques. This uses structured questions to compare answers. For example, if a person changed their story when asked the same question differently, it may indicate deception. Number three is psychological tests. These include personality or stress tests used as a support tool, not as a direct proof of lying. Number four is voice stress analysis, VSA. This detects stress in a person's voice. For example, a shaky or tense voice may suggest nervousness. Number five is brain-based methods, EEG or fMRI. These measure brain activity to see how a person responds when answering questions. Number six is polygraph test. This measure physical reaction like heart rate, breathing, and sweating. For example, a sudden increase in heart rate may indicate stress when lying. Lie detection is not just about catching lies, it is about analyzing different signs carefully. By understanding this technique, we can better evaluate situation, but we must remember that no method is 100% accurate.
Good day everyone, I'm Ariel Malit. Now let's talk about the factors that can affect the accuracy of polygraph test, or commonly known as a lie detector test. First, we have examiner-related factors. These are factors related to the person being tested. For example, if a person feels nervous, scared, or anxious, their body may react strongly even they are telling the truth. Also, if they are tired, sick, or under influence of alcohol, the result can be affected. In some cases, mental health condition or trauma can also change a person's response. And sometimes, a person may try to control their breathing or feel pain on purpose just to trick the machine. Second, we have the examiner related factors. This refers to the person conducting the test. If the examiner lacks of experience or skill, the result may not be accurate. Also, if the examiner is biased or already expect a certain answer, it can affect how they interpret the result. That's why proper training is very important. Third is question formulation. The way questions are asked matter a lot. If the questions are confusing or unclear, the person might misunderstand them. Also, if they are poor balance between control questions and relevant questions, the comparison become unreliable. Fourth, we have testing condition. The environment can also affect the test. For example, noise, uncomfortable temperature, or distraction can make the person uneasy. If the pre-test interview is not done properly, or if the examined doesn't fully understand the process, the result may not be accurate.
Fifth is instrumentation and technique. The machine itself must be properly working. If it's not calibrated correctly, the results can be wrong. Also, the examiner must use proper technique and correctly interpret the charts. Lastly, we have theoretical limitation. It is important to remember that a polygraph does not directly detect lies. It only measures body reactions like heart rate and breathing. This means a truthful person might appear nervous, while a person who is lying might stay calm.